Hi, everyone, and welcome to the second session of Digitodontics Webinar Series. This is Mahmoud El-Bishti with you today from the Digitodontics International Academy. It's our pleasure and honor to welcome our guest speaker, Dr. Mariko Hattori, from the Department of Advanced Prosthodontics, Tokyo Medical and Dental University, TMDU, Japan. Dr. Hattori will share with us her experience in digital evaluation in musician dentistry, an effective tool for performance. Dr. Mariko Hattori is an assistant professor at Tokyo Medical and Dental University, TMDU, Japan, since 2005. She graduated from the Faculty of Dentistry at TMDU with the DDS degree in 2001, and then she obtained her PhD from the Department of Maxillofacial Prosthetics of Tokyo Medical and Dental University in 2005. She is also working as a maxillofacial prosthetic specialist at the Clinic for Maxillofacial Prosthetics of the TMDU University Hospital. She was a visiting professor at the Department of Prosthetic Dentistry of Freiburg University, Germany, between 2016 and 2017. Dr. Hattori is a member of the Japan Academy of Maxillofacial Prosthetics, JAM, and the Japan Prosthodontic Society, JPS. She is contributing to maxillofacial prosthetic patients and musician patients locally and internationally from various aspects, such as the evaluation of speech and music performance for the patients. In 2022, she contributed to establish the Japanese Performing Art Medicine Association, JAPAMA, as a co-founder. In addition, she is intensively contributed to the literature through the various publications in many international peer-reviewed journals and conference presentations. So just before Dr. Hattori start her presentation, I would like to raise your attention that you can write your questions on the Q&A part, and then Dr. Hattori will be happy to answer all these questions. So without any delay, let us once again welcome our speaker today, Dr. Hattori. I'm glad to having you with us today here. So without any delay, please, the stage is yours. Please share your screen.
Hello, everyone. Good evening, good morning, good afternoon, everybody in the world. My name is Dr. Mariko Hattori from Tokyo. Thank you, Dr. El-Bashti, for the introduction. Today, I'm going to talk about digital evaluation in musicians' dentistry. Let me share my screen.
Yes, please. Looks good. Yeah.
Right, I start my presentation now. What is musicians' dentistry? Musicians' dentistry contains many aspects such as dental hygiene for musicians, caries treatment for musicians, and denture fabrication for musicians with missing teeth, or music splint fabrication for lip irritation. Let me share some cases so that you can imagine more about the clinical situation of musician in dentistry. This is the first case that I can share you today. A 50-year-old male clarinet player. He had a moving anterior teeth, which made him difficult to play the clarinet. What we have done for him was like this: general periodontal treatment for the teeth, and also extraction of those moving anterior teeth, and also the fabrication of removable partial denture. He used this denture for playing the clarinet and also for the daily use, such as speaking, swallowing, and mastication. That is what he could manage. And now he's playing the clarinet with this denture for his recording and also the playing in front of a lot of people. Case 2 is a 70-year-old clarinet player who was suffered from the mucosal erosion and pain of the lower lip. As you see on the picture, she had different dentition on the lower jaw, crowded teeth on the anterior mandibular incisor. And then what we have done for her was making a music splint that covers her lower incisors. With this music splint, she didn't feel any more pain on her lower lip, and she went back to her orchestra. She is an amateur player who played clarinet for fun. Case 3 is a little girl, 10-year-old girl, who had maxillectomy because of sarcoma. She had a tumor on the upper jaw. She had to play the recorder at school in the music class. It was mandatory for her. At first, she could not blow the recorder very well, but we adjusted the obturator until she plays better. The sealing by the obturator enabled her to blow longer with the recorder. And she was happy because she could attend and join the music class with all other friends in the class. So these are the examples that what dentists can do for musician. And here I can share some basic knowledge about wind instruments. What are wind instruments? Wind instruments are divided into two different groups. One is woodwinds and the other is brass instruments. The group of woodwinds are again divided into three different groups. One is single reed instruments, double reed instruments, and flute and piccolo group. I can show you one by one the example of instruments so that you will get more imagination about the music instruments. Today, I collected as many instruments as possible to show you the real music instruments in the Zoom view. Firstly, I show you single reed instruments. Here I can show you a saxophone, which is shaping like this. This is a alto saxophone with a mouthpiece here. The mouthpiece is possible to take away like this, okay? This is separated mouthpiece. And I can show you the detail of the mouthpiece after I get rid of this too here. Okay, so here is the mouthpiece of single reed instrument. Reed is something here, very thin piece of plant which make vibration to make sound. Only one reed is placed underneath of the mouthpiece. This is how the mouthpiece of single reed instrument shapes like. Okay, and this is positioned like this. Lower lip positions on the lower incisor, and up on it, the mouthpiece comes like this. And then the upper teeth goes directly onto the mouthpiece like this. The sound is made by the vibration of the very thin reed here. This is how single reed instruments make sound. And you see the sagittal view, how the mouthpiece is folded by teeth and lip. There are some other single reed instruments, such as soprano saxophone. This is smaller than alto saxophone, which has smaller mouthpiece like this. I can compare it with the mouthpiece of alto saxophone. This is the difference, you see? And I also can show you the mouthpiece of tenor saxophone that is even larger, like this. Okay, so this is the view from this side, and the other side is like this. All of them have single reed underneath. You see? Okay, so this is how the mouthpiece of single reed instruments look like. Clarinet is also one of those instruments group. And the remarkable thing is that only with this part the sound is made. So even if the dental clinic is not soundproofed, or even if not in separated individual room, you still can ask patient to bring only this part to confirm if the teeth are fitting to the mouthpiece or not. That is one idea for musicians' dentistry. Okay, let's move on to next. Next group is double reed instruments. One example of double reed instrument is like this. Something like this. This is an oboe. And here there is a reed. Again, this part is removable. I remove it for you. Like this. Okay? So this is the oboe and this part is reed. And I can show you the reed in detail like this. Do you see? Okay, this side is looking like this, but the other side is also looking like this. It means both sides are the reed. Both sides are very thin strip made by plant, and both of them vibrate together to make a sound in the mouth. So as the same as the single reed instruments, this kind of mouthpiece is called intraoral mouthpiece. This is how the sound is made by two strips. I hope you saw it. And another instrument that is on the slide is called bassoon. It's even larger, very long, that makes very low sound. But the way of making sound is quite similar to this. Two reeds get together and sometimes apart, and this make vibration to make a sound. And you see, this kind of instrument have a lot of metals, but it is still called woodwind because in history, this kind of instrument was made only by wood. If you want to understand about history more, I can share something that make you easier to understand about it. This is also one of a double reed instrument, and it's a traditional Japanese instrument. It's called Japanese shichiriki, used in gagaku orchestra. This also has two size, similar looking reed. It is double reed instrument and only made by bamboo, paper, and wood. This is from Japan and oboe is from Europe. So this is not the real origin of the European instrument, but still you can imagine, I guess, how this kind of instrument has the history. So this can make you imagine how these kind of instruments are called woodwind. All right, let's go to next. Okay, for this one, I have to show you how it is held. So 2 lips, upper lip and lower lip, both of them go into the mouth like this. Okay, so both teeth, upper teeth and lower teeth, both of them are covered by lips. This is how double reed instruments are. Hold it by the mouth. Okay, let's go to the next one. Brass instrument. Brass instruments are something looking like this. Let's see. Brass instrument. Brass instruments are made by a long tube which is rounded and folded, and one mouthpiece here, and the other side which has this kind of shape to make the sound louder and wider, spread to listen by many people. And if this tube is not folded and rounded, it becomes very long and inconvenient instrument, such as Alp horn. That is also a kind of same group instrument. And also this part is removable like this. This is the mouthpiece of trumpet. Okay, this is the mouthpiece of trumpet, and this is positioned like this. Now, the mouthpiece is entirely out of the mouth. So this is called extraoral mouthpiece. And the vibrations are made by lips. No reed inside, but my lip is making the vibration. Actually, even without this one, people can make sound like this. My upper lip and lower lip are vibrating together to make a sound. Please note that musicians can make music only with one mouthpiece, or even without instrument they can make music. Any kind of sound they can make. And this is trumpet. I also can show you something larger. Here I can show you another brass instrument, which is called trombone. This is trombone. This is too large to make everything in the camera. It's long. And which this has a slide to make a different sound. This has larger mouthpiece like this that covers more part of the mouth like this. With the instrument, it make better sound. I hope it's better. If I make this slide moved, the sound is differentiated, like the sound is changed like this. But even if I don't move anything, this kind of instrument can make many different sounds like this. I don't move any fingering. I don't make any the slight movement, but I make a different tone like this. Did you see that I didn't move anything on the right hand? What I have done was just changing my lips and muscles around here to make different sound, different tension. This is the big character of brass instruments. In woodwind instrument, it is also possible to make some different tone with same fingering, but in brass instrument, it's even more. Only with the one same fingering and very much variation of tone, made because of the changing of body itself. Now, I think you can imagine how the orofacial region acts so important for music playing. See, no change by finger or hand, but only this part make very different music. The controlling orofacial area, it's so important for playing music using this kind of instrument. That's what I wanted to show you. Great. This should be there. So I show you the trumpets mouthpiece and trombone mouthpiece. And also I can show you the biggest one. This is tuba. Tuba is the biggest. I show you how it fits to my mouth. So this mouthpiece covers almost all of my upper lip and lower lip. Very low sound is made by this big mouthpiece, okay? And another instrument grouped in brass instrument is horn, the rounded one. I heard that the horns have the smallest mouthpiece. That is not equally pushed to upper lip and lower lip because it is too small, not equally balanced to both lip, but only one of them is pushed by it. So we should know what kind of instrument is played by the patient because it's so different. The area, the pressure, everything is different in each instrument. This is tuba, this is trombone, this is trumpet. Okay, please see the difference between those mouthpiece. And again, musicians can make different tone and something like melody only with mouthpiece. So if you don't have enough space or soundproof room or anything in your dental practice, you can ask patient just to bring this one to try with the new temporary crown, temporary bridge, or wax denture to confirm the fit. This is possible on the chair side. And now a lot of different materials are used to make instrument, and sometimes patients have this kind of special instrument made by different material. This is made by plastic, clear plastic. This is really helpful for dentists to know what is going on in the mouthpiece because you can see through. It's clear and you can see through. So if a patient has something like this, you should definitely tell him or her to bring this to the clinic so that you can see what is going on with new temporary crown or whatever. All right. So these are brass instruments. And the last group that I can show you as normal orchestra instruments are flute and piccolo group instrument like this. The big character of this kind of instrument is the way of holding it. This is in this way, not straight way, but horizontal way, right? This is flute. Again, the head part is removable like this. Okay, very small part is taken away from the body of the instrument like this, and only with this one still possible to make sound. Here you see a hole that is making a sound. Again, this is an extraoral mouthpiece. Nothing goes into my mouth. Do you see the sagittal view of the playing flute anatomy? The flute is pushed onto the lower lip, and the other side is the teeth, the incisor, lower incisor, like this. And the air is made, the air flow is made through the small opening between the lips, and it hits to the edge of this hole. This is how the sound is made. So again, very different mechanism of making the sound. Okay, and this is also a kind of woodwind group. And you see this is metal, and why this is woodwind. If you are not sure about it, please have a look of another flute group instrument. This is again Japanese traditional instrument, which is called ryuteki, which is fully made by wood and shaped like this, the same. Okay, so I think it helps you to imagine what the history of these kind of instruments is. Okay, so this is flute and piccolo. Piccolo is smaller. Piccolo is smaller flute. So so called. Right, and let's move on to another slide that shows instruments often used in school music class. I think it depends on culture. It depends on the education in different area, different countries. Especially, no, at least in Japan, they have music class in every school. Everywhere, children play music in the class. They learn music as same as like mathematics or Japanese or PE or anything. They just learn music at school. And the instruments that they use there is a little bit different from orchestral instruments, but something like this. This is recorder. Recorder should be holded like this, not this way, but like this way. And this is very easy blowing instrument, I can say. Very low with low pressure, I still can make sound. Easy to blow. And this is alto recorder, which is larger than soprano recorder. Different design, but same kind of instrument. Soprano recorder, alto recorder. In Japan, usually elementary school children learn soprano recorder and junior high school students learn alto recorder at school. But sometimes elder students in elementary school also play alto recorder. I think it is easier with low pressure Once I had a oboe player patient. She had trauma and she couldn't play oboe for a while, but she said she could play recorder without any problem, even right after the injury. That's what she said. It can be played by low pressure. And also harmonica. Harmonica, it's something like this. Harmonica. This is also very unique instrument. I show you many blowing instrument today, but only this one needs the air going into the other way. Not only the air going out, but going in should be made to play this instrument. Blow out, blow in, like this. Blow out, in, out, in, out, in, out. This is how the sound is made. It's really special, I think. Yeah. Ingressive way. And the last one is keyboard harmonica. This looks like piano. This looks like piano with keyboard, but still needs your air. It's a blowing instrument, but still possible to play with finger. So it is possible to make many sounds together. This is also very unique. I have shown you a lot of instruments. All of them could make only one tone at once, but only this one can make 2-3 tones at once, like this. Like this. Okay, and I feel it needs a bit more pressure than recorder. So you should, I think, if you know the character of these different instruments, you can advise your patient, for example, cleft lip and palate child patient, to select one of the instruments for school concert or something. You can just advise like, if you want to try a harmonica, keyboard harmonica, it's okay, but it could be easier if you choose recorder, especially for the smaller one, for example, like that. You can advise them like that. That's what I think. That's what I think as benefit as dentist knows some part about music. Anyway, they have to play something at school. And other instruments that can be influenced by orofacial area are like this. Maybe not so much, but somehow it could be influenced. Strings. Strings are instruments like this. Some strings are here to make a sound. And this kind of instrument is held by neck, like this. Mandibular is supporting this instrument. Now I'm not keeping it with my hand, but only my mandibular is keeping this instrument. So if something happens on the jaw, it might be more difficult to play this kind of instrument. Or sometimes like temporal mandibular disease can make some influence to play this kind of material instrument, like this. So this kind of instruments could be also concerned by dentists too. That's what I thought. Violin and viola. This is viola. Violin is a bit smaller, but something similar like this. And larger string instrument, cello and contrabass. I don't think they are influenced by any orofacial problem. Of course, if they have like a toothache, they cannot concentrate to play the cello. It can be happened, but it's not musician specific. It's also for the same for other job. And the last one is singing. Singing, of course, needs teeth, tongue, cheek, everything around here. And it is quite similar to see speaking, because singers are interested in how to pronounce and how to make words as sound. So it's quite similar to speech analysis. And some part, not non speaking part, but the voice itself is made in a vocal cord like this. And this part, dentists cannot do anything. If they say like they want to sing in a better voice, it's not our job to make any change to the throat. What we can do is above here. So about the pronunciation part, dentists can do something. That's what I think. Right, and problems and treatment. Let's go to the next part. Those musicians can have some dental problems such as periodontitis, caries, missing teeth, jaw defect like maxillofacial defect, or temporomandibular disease, of course. But for these problems, what dentists should do is also like the same as other professionals or other people. It shouldn't be any musician specific treatment. We should just do the fine dentistry to them. That is enough. But one thing that we should concern is that we should always confirm if the patient is comfortable with playing music with this condition or not. So even for the caries treatment or crown and bridge, you can try once with temporary restoration, and patient can try it with playing. And for the temporary crown and bridge, you don't have to tell patients to bring their instrument, because patients can bring crowns to home and they can try the instrument at home. But for the denture, for example, wax denture trial shouldn't be done at home. So in that case, you should ask patients to bring their instrument, or at least mouthpiece part to check the fit. That's very important. But what we do for those patients should be basically the same as other patients. And only the last one, lip irritation, can be solved by music splint, and this is very musician specific treatment. So I can show you the next slide. These are the example of music splints. The upper half is showing the music splint for woodwind playing. Woodwind, do you remember? With this kind of mouthpiece. Okay, and the lower pictured show the music splints for brass player. Brass is something like this. Okay, so this kind of appliance can help patients to play without having pain or injury, especially in the case of crowded teeth. Okay, and how we can evaluate the outcome of the treatment. Please see this slide. It says questionnaire and functional analysis, acoustic analysis, 3D analysis can be done also. Let's see one by one. Questionnaire, this is not very digital. Today's topic is digital, but this is kind of very subjective, but it's still showing some numbers. So it's different from just asking patient what he or she feels. It's rating with numbers, so it's more like comparable with some between some conditions. This is using the 1 to 10 scale, but sometimes visual analog scale is also okay. This is about sense of stability, discomfort of prosthesis, fit of the reed, blowing, sound, overall, something like that. And what we also do more in a objective way is acoustic analysis. We check maximum blowing time, rhythm analysis, playing range, psychoacoustic analysis, and so on. This is maximum blowing time. Very simple, how long you can make. This is very simple, but important, especially for like the children case. They are still learning. They are in the middle of learning, or they are the beginner, and they cannot play something difficult, but blowing longer. It's really easy and easy to play and easy to understand the outcome, like this. Long, as long as possible, and to compare. That's one way to analyze. Very simple, very simple. Another way of acoustic analysis is this one, rhythm analysis. These notes are decided for a very advanced, experienced musician. It is too difficult. It's very difficult. It's too difficult. For the intermediate player, it could be like this. Also fine. Or even like this is also possible. What we do for this analysis is calculating each sound length, the time, and analyze if it is stable or not. What I have done now was a playing which is called single tonguing. This is single tonguing, and there are different tonguings which is called double tonguing or sometimes triple tonguing. I show you the double tonguing. This is double tonguing. My tongue is moving like once in the front to make closure, and second one is to the back to make another closure. This can make faster playing. This is double tonguing. And some players complain like, I can do single tonguing very well, but with this music splint, my double tonguing becomes slow or not clear or something like that. They sometimes say this kind of things. So rhythm analysis to see if it is stable or not. Very simple analysis. And melody playing is also sometimes important. Just make a overall evaluation to record something that is repeatably recorded. I mean, patients usually have some favorite piece of music that they can play anytime to compare the condition. It could be very short, it could be shorter, and it should be easy, not too difficult, and something that they like is better. It shouldn't be so long. If it is too long, it's difficult to compare. For recorder, maybe something like this. This is enough. And this kind of recording reminds them how they played in that moment if it is replayed to them. So the mixture of this kind of basic long tone and staccato and melody, the mixture of those recording is very helpful for also for dentists and also for the patients to think to think and compare the condition of the playing, the performance. And I show you some more advanced analysis. This is called playing range. This is the range how they can play. The range of the pitch from low tone to high tone, and also the range of the volume, the dynamics too. In the case, I take this, I ask patient to make very low sound and very loud sound, and also quiet again, from very low tone to high pitch, something like that. That's what I ask patient to make. And another analysis is psychoacoustic analysis, using some specific system, which can show the parameters such as sharpness and loudness in psychoacoustic in analysis. And in this kind of analysis, I ask patients to play in different dynamics, pianissimo, very low, and fortissimo, very energetic, and to compare if those three are effectively differentiated by themselves, by each other or not. If you have something uncomfortable in your mouth, it's very difficult to control the playing, especially for the pianissimo, very low sound, very quiet sound. It's very difficult to control if you have something very uncomfortable in the mouth. So this kind of analysis also help us to find the difference or to figure out what is going on, the performance. Here I show you the reference, and I can show you some real view of analyzing the sound at the end of this lecture. You see my screen. This is this view of Wave Surfer. Okay. This is the free software that anybody can download from the internet, Wave Surfer. And I can show you. This is my best favorite recorder, soprano. So this is the rhythm analysis. You can record the playing, and later you can find out when it was played and calculate if it was stable or not. For the simple analysis, such as long tone, the maximum playing time, this kind of software is also useful. you can just simply ask the patient to play longer and measure the length. It's easier with this kind of software because patients can see how long they made. It's also easy to have conversation and explanation to the patient with this kind of view. Okay, so this is the end of my lecture webinar, and I welcome your questions or your experience also.
Thank you, Dr. Hattori, so much for your interesting and different presentations, because we know all that patients with or musicians sometimes is very need special skills to analyze patients, to be help them to perform nice music playing. So you explained to us many aspects that related to the musician dentistry, which is relatively kind of not common that you see this topic to explain it to the dentist and the people who are interested in dentistry. So thank you so much for really informative informations. And also I like the way you playing with the instruments and give a live example for the participants to know how to do and play the instrument, a different type of an instrument. So it's very interesting. So I really thank you for that. So participants, please don't be shy to ask any questions. So Dr. Hattori would like to see some questions, so she can answer them. I have a question for you, Dr. Hattori. If, for example, you have a patient who is wearing a new denture, and you know that when we provide a new dentures for patients, it becomes kind of strange thing inside the mouth, and even for the tongue, it's a play around to find the comfortable way, even for the speech. In terms of playing music, if the patients found that the denture is different, what is the practical ways to solve such kind of issues for a musician?
Thank you very much for the question. This is very practical question, I think, in clinic. And yeah, it is true that new denture make uncomfortable feeling for the patient. And for the first term, I usually ask patient to try to play the instrument with the new denture somehow for like 1 week or 2 weeks. Sometimes the tongue and other tissues like buccal mucosa or some other surrounding tissue can learn the new shape quickly and adapt to the new one so quickly. So what I think is it's too early to decide if it is good or not at the initial time when the patient got the new denture and she said, is it difficult? But I just make them try at home for some time. And sometimes just this kind of time make it solve the problem. And another thing is that sometimes the knowledge about the anatomy and function can help patient to solve the problems by themselves. Sometimes patients just don't know how the music is made or how the function is like intraorally, and sometimes the view like the what I showed in the presentation, the like sagittal view of the intraoral area can help them to understand what is going on and can help them to tell us the problem, for example. So sometimes the education for the patient is also helpful. Those two, so to try first and tell them what is going on, and also to evaluate them using some impression material or some paste or anything to know the hidden area is also important. So I usually ask them to bring the mouthpiece for the denture adjustment, for example. That is also possible. And what I usually do is I make denture a bit larger, and then I cut the unnecessary part. That's easier than adding. That's what I usually do.
Yeah, so what I can see from your answer that visualizing the issue for the patient is very important. And we are in Digitodontics session. So I think digital technology and especially 3D models can be very helpful for the patients to understand the anatomy, how the instrument to be placed and played when there is a new denture is inserted in the patients. We have one question from Dr. Anshu. It's very nice presentation, he said, very knowledgeable. And he asked, when you make dentures for musician, do you take care of palatal shape? Any modification you do in prosthesis? So that's his question.
Thank you, Dr. Chu, for the question. And of course, thank you for joining this webinar. The shape of the palatal base, that is very important for musician. But what I believe is, firstly, the basics should be based on the prosthodontic way. So it's the denture should be stable, denture should be retained well without moving, and it shouldn't harm any other teeth. And some special thing that I have ever made for patient is modifying some part of the front of the palate to make a bit thinner, to make more sensitive control of the tonguing. The palatal side of the incisor is also very important to make sensitive control of the tonguing. So I sometimes make it more like natural teeth. Sometimes the palatal side of the polished surface is really polished like nothing to make better hygiene, but sometimes this doesn't make good positioning of the tongue because there's no feedback from the too much polished surface. So I sometimes make it more like natural teeth curving on the palatal side. And that's what I try. And also I sometimes make some digital analysis on the impression of the intraoral impression to make the figure and anatomy and function while playing the instrument. That also helps me to design the prosthesis. Thank you for the question.
Okay, we have another question from Dr. Wang. For those musicians having failed anterior teeth, do you think that fixed prostheses are more suitable for the replacement of missing teeth? Do you worry about the force applied on the prosthesis and its causes failure for the prosthesis? Example, porcelain chipping.
Thank you very much for the question, Dr. Wang. For those musicians having failed anterioritis, okay, it depends on patient and depends on the situation. For the case that I shared today, I firstly made removable partial denture because I think reversible treatment, how can I say, the reversible treatment is better to try first because making bridge, for example, or making implant that is irreversible. If I do it, I can't go back. But making prosthesis, very less change into his natural dentition. So I firstly tried with the partial denture, and actually he was happy with it. So I just didn't go further because he was happy about it. And for other cases, in some cases, in some patients, they did not accept the removable one. I also tried one removable partial denture for an oboist, but she just did not accept it. So I went to another step of the treatment, and then I went to implant prosthesis. But it did not make any tipping or anything. I still believe that the concept should be the same as other prosthodontic basics, and it should be done in a fine way, and it would be all right. But the sometimes we have to consider the way of the force. It's sometimes different from biting force. For biting, I mean chewing, biting, mastication way is like horizontal way. Vertical way, but sometimes instrument pushes the teeth to the other way. So we also have to think about force. That is true. That is true.
Yeah, we have another question from Dr. Chaudhry. He said, thank you very much for the nice presentation. And he asked how to adjust the teeth for the mouthpiece of the instrument. So this is his first question. The second one, does the musician need any special practice?
Very interesting, very interesting. Does musician need any special practice? That could be another topic of my research. This is very interesting. Thank you, Dr. Chaudhry. Okay, I can share one of my experience about the teeth adjustment. For example, a case of saxophone player who got an injured central incisor. In that case, he had a fractured tip of the tooth. It was impossible to put it back to the tooth because it's already broken, but still that broken part of tooth helped me to understand the original shape of his teeth, and it helped me to make it more like his original tooth outline, just like before he got injured the central incisor with composite resin. That was what I have done in one case. But even in that case, I asked the patient to bring the instrument to try as he usually plays, and confirmed the fit of the teeth to the mouthpiece. So most important is important for the experienced musician. They already know how to play, and they already know how to play with their dentition. So the more important is to make it like the same as what they had before. And if they have some more extra hope to make it even better, of course I can try for some modification. But firstly, we have to think about the the outline that he or she had before having caries or before having periodontitis, trauma, anything like that. And what I do is actually, if I ask patient to blow the instrument in a real way, I don't see anything. So in that case, I just ask patient to keep the mouthpiece in the mouth, but to open the upper lip a bit so that I can see the fit. That's what I usually do. And for the practice, I'm so much interested in just from some experience, like the trauma case. I heard that the musician started with easier passage, not very difficult piece, but she started from the basic. Actually, she started from the easier instrument also, and also easier passage, easier melody, and then made it more in the normal way. That's what I heard, but it's not, I haven't done any scientific try about it. Thank you for the new idea.
Thank you so much. I have a question myself. You know that we are interested a lot in 3 dimensions data and everything. But again, 3D data is not really enough in terms of music analysis or sound analysis of or the movement or stuff like that. And we know that 4D is the another promising way to be used for dentistry. Have you go to that direction to apply 4D technologies for musician dentistry or in dentistry in general? So can you touch on that, please?
Thank you for the question. Yes, 4D is very interesting, but very tough to analyze. For the question, I can answer yes. I tried some people playing instrument to capture in 4D way some people playing the instrument. And what I have done with this data is not really a 4D analysis as a whole, but anyway, I stopped motion to motion and got the 3D data and matched them together. That's what I should do. But what I believe is analyzing 4D data in 4D way, not making it 3D, or if you cut, it makes it into 2D. And if you measure, then it becomes 1D. But usually what researchers do usually about 4D analysis sometimes like this. They just capture, making it 3D, and then slice, that's 2D. Then finally they measure. That's not a real 4D analysis. So I think I have to find the way that I can analyze the 4D data in 4D way, but it is very difficult. And I think I have to study a lot of math for it.
Okay, that's nice. I'm sure you can do it. So it's a great. That's fantastic. So the participants are thanking you a lot. They are happy with the what they have learned today. It's very interesting. So with that, we are going to conclude our webinar today. So I would like to thank you for what you have presented for us. And as tradition for Digitodontics, we are happy to present you a certificate of appreciation. So we hereby express our sincere appreciation to Dr. Mariko Hattori in recognition of her contribution as a live webinar speaker for Digitodontics Webinar Series on the topic of Digital Evaluation in Musician Dentistry, an effective tool for performance. That was presented on Tuesday, November 22nd, 2022. So thank you so much, Dr. Hattori, for your time and for the valuable information that you shared with us. Thank you.
Thank you very much.
Thank you. And also, I would like to thank all the participants for their time to be with us today. And again, we still have many more valuable presentations that we will be presented in the next few months. So stay tuned, and we would like to see you all in the next webinar. So have a nice day, nice evening, and nice night. So take care. Bye-bye. Thank you. So can we hear something while you are playing? Can you play something for us? I know you are experiencing that. So it's very nice to, to conclude the webinar with the a nice piece of playing. Yeah, please. Thank you so much. It was very nice. Thank you. Bye.